1972 graduate of United Township High School in East Moline, Illinois, and a 1976 graduate of Augustana College, Rock Island, Illinois. Since August 1995 for comics fandom in the early 1970s, Bischoff wrote his column for 7 years. He pioneered reporting on comic book conventions and in analyzing price fluctuations in the collectible marketplace. Bischoff is the winner of an Inkpot Award from the San Diego Comic-Con in 1980. He worked as a business manager for artist and publisher Jim Stranko at Supergraphics in Reading, Pennsylvania.
Hear stories about doing the right thing. The refusal to do the right thing or to deliberately do something else triggered all of the incidents that you're going to hear about tonight. When we look at Pierce City in 1901, we look at several different, a pogrom, because that's the only term that we can use for the way towns turn on their neighbors. In this instance, Pierce City was not a town of peace and quiet all the time. This was a town of immigrants who came from the north, who had African Americans, there were Irishmen. Why would he do that? He could have started over anywhere. But his family was there, his family was established there, respected there, and perhaps even his lady friend, whom he quickly marries upon return, was waiting for him. He moves in with her and her widowed mother, gets a job as a waiter in a hotel, and goes about his life. Then comes the murder of Gisela Wilde in 1901. A heinous murder, terrible thing. Struck down on her way home from church, her throat cut. There were no eyewitnesses. The forensic evidence was dubious. And the bloodhounds that came 30 hours later over ground that had been tromped over by the National Guard the previous night, American who was in that lineup in 1890, Pete Hampton, who by this time was the heir apparent, the patriarch in waiting of the African American community. He had been a target for a couple of years by the local law enforcement. But they didn't get Pete Hampton that way. It was around 11 o'clock that night when Douglas and the others realized that the National Guard armory down the street next door to the jail had Springfield rifles in it, that things got really ugly, because their shotguns and the pistols that a typical Southwest Missouri homeowner would own did nothing at great distance. But this mob reorganized with those Springfield rifles and marched on the home of French Godley, who was the stepfather of Pete Hampton and the uncle of Will Godley. And they demanded that Pete Hampton come out. And Pete went to the upper story window and shot his rifle at the mob. Now, that was his answer. F you. Not that he could hit anybody with his rifle, but in response, the mob pulled out those Springfield rifles and filled that house with holes. And Pete was killed, and French Godley was killed. Then they retreated across the railroad tracks and shot at the African American homes until their 1,600 rounds of ammunition were expired for the next several hours. And still the African Americans did not budge. Then around 1:30 in the morning, somebody starts setting fire to the houses to the Godley's house and to the four houses next to them. And at that point, the African Americans ran for it. One Saturday in 1990, I was standing in the public library in Pierce City, and I found a clipping from the Joplin Globe that had recently come to that library because Catherine Platt, a senior citizen in that town, had just gone to the nursing home. And Catherine was a pack rat. Her father had a business in Pierce City for decades. And within that stuff was the Joplin Globe's account of that night in Pierce City. And the hair on my neck stood up. It's like, how in the world could such a thing have happened? So I decided I need to know about this. And over time, I started combing every record, every court record, every newspaper record, everything I could find to determine what happened there. I got the newspaper microfilms from the turn of the century, and I said, if Pierce City is a hostile town, that will show in the newspaper. And what I found was exactly the opposite. I found in some of the earliest accounts that I was reading in January of 1900, an account by an African-American school teacher who had come to Pierce City, who taught at that school, and he had published an essay listing about 100 prominent Africans and African Americans who had achieved great success. This teacher was a Booker T. Washington disciple, pick yourselves up by the bootstraps type of guy. And he was believing in education. You get these people strong and you have good communities. This was printed in its entirety in the newspaper, as were many items about the African American community and church activities. This did not reflect the type of town that would do such a thing. So I eventually wrote the first account of this incident for the 90th anniversary of what happened in Pierce City.
And also I want to thank Lee for inviting me. You guys have a true treasure in me here. So hopefully you do everything that you can to thank her for bringing folks like us to campus and these kinds of programs. As Lee mentioned in reading my bio, my training is sort of interdisciplinary, and so I work at a school of public health. And one of the interesting things that I try to understand is the impact of our social and physical environments on health and segregation realities for many people. And I'll show you a couple of examples from St. Louis about how segregation affects health. If you want to go ahead and thank you. And thank you, Chris, for advancing the slides. So if you see me move my hand, it's to signal to Chris in the back that I'm ready for the next slide. So one of the important things to remember in terms of thinking about segregation itself is it really stems from this broad idea of sort of discrimination and the reality that racism does exist, homophobia does exist, which is also reflected in the title. So in that particular project, we looked at different health outcomes and different factors that determine health outcomes in St. Louis City and St. Louis County. And the report that I worked on was focusing on the impact of segregation in health. And so as you can see, we start in the late 1800s, the Plessy versus Ferguson case. And we go all the way to the 60s and looking at the different impact of policies, of structures that basically led to the separation of blacks and whites living together. As Lee mentioned in her opening remarks, we're far more divided today than we were once before. And we have to ask that question, why did this happen? How did this happen? And as we heard earlier, sort of what kinds of things do we need to do to make sure that we are not further divided and further segregated? When we think about segregation, and we think about it largely from the viewpoint and the perspective of housing. So disparities in housing suggest geographic steering of Black home buyers. This is a common practice that still remains. Residents of predominantly Black neighborhoods have access to roughly half as many social services as those in predominantly white neighborhoods. And so these are some of the realities that occur as a result of being segregated. Home ownership rates for whites are a number of percentage points higher than for Blacks. And so when we think about who actually owns homes, that being part of the larger American dream, many African Americans and actually even Hispanics don't own very many homes. So when we think about the impact of segregation and its effects on health, there's a number of different ways that we can think about it. So segregation determines SES, so socioeconomic status, by affecting the quality of education and employment opportunities. It can create a pathogenic neighborhood and housing conditions. So when we think about poor housing quality, or we look at houses that have high levels of lead, or even when we think about the example of Flint, Michigan. Flint is a largely poor community, largely African American and other minority groups. We think about sort of what factors and structures led to those divisions, but also the quality of housing, the quality of schools, the quality of employment opportunities, as well as even access to medical care facilities. And those are all largely determined by where we live. You can go to the next one. So in the world of public health, we often talk about health disparities. And so health disparities is broadly defined as differences. And so we have all kinds of differences in health status based on income, based on educational level, differences in health status between men and women. We all know that women live longer than men. Also, when we think about differences in age groups, so younger people tend to be more vulnerable than sort of, say, middle age. When we think about all sorts of differences or factors that may lead to why people live longer, why people get sick versus other people, that's what we're talking about when I use this word, health disparities. Go to the next slide. So health disparities have persisted in St. Louis region for a number of decades. So African American health, so higher rates of infectious and chronic diseases, higher rates of avoidable hospital admissions. African Americans are more likely to be diagnosed with later stages of diseases such as breast cancer, prostate cancer, cardiovascular disease. In 2000, the Black to white ratio in infant mortality was 2.5, 2 to 5. African Americans are 3 times more likely to fall below the poverty line, and unemployment rates in St. Louis are double that for African Americans compared to white citizens of St. Louis and St. Louis County. Go to the next one. So one of the things that sort of the movements in public health to try to address or try to really take account for the importance of where people live is this idea that place matters. And so it's often quoted that your zip code is a better predictor of your health sometimes than your own genetic code. And that suggests that where we live is extremely important. We put a lot of stock into sort of what happens in our neighborhoods, what happens into our communities. And that's a very important place for us to think about interventions, to think about programs, to think about policy solutions as well, in terms of making sure that these types of environments are healthy so that we can have access to better education, better employment opportunities. And so when we think about segregation, we think that these resources are dispersed in a number of different ways, and so people don't have equal access to these types of resources. So when we think, again, so a number of ways that segregation has an impact on sort of our economics, our education, our healthcare systems, our school systems. And so that's another way of thinking about the systems that matter in terms of that are affected by segregation. So in St. Louis, African Americans are concentrated in 15 of the 115 counties across Missouri. 2 of these are St. Louis City and St. Louis County. St. Louis is one of the most segregated cities in the U.S. So Lee was talking about the differences between a city that's completely segregated and completely integrated, going from 0 to 100. St. Louis ranks 9th in those rankings. St. Louis is 9th in the country in terms of being one of the most segregated cities in terms of blacks and whites in the country. So discriminatory housing practices played a large role in shaping hyper-segregated communities. And African Americans tend to live in segregated neighborhoods regardless of their income. And so this also suggests that there not only are people segregated based on class, but also based on race. And that's really an important distinction to remember. Sort of the intersections of both sort of race and class really sort of factor into where people live. And it also factors into the idea of sort of where people feel comfortable living as well. So when we think about, for example, I have a colleague at the University of Maryland, one of the things that he talks about is African American men are far more likely to be physically active running in their neighborhoods in predominantly black neighborhoods compared to more integrated or predominantly white neighborhoods. And the idea is that a black man running in an integrated neighborhood or in a white neighborhood might be running from something, and so that they may be viewed as a criminal in those types of environments and communities. And it's really important to think about sort of racial identity, how people view themselves, how people are viewed by other people, and how people interact in those different environments. So for those of you who have been to St. Louis and hung out in St. Louis, you probably are familiar with an area called the Del Mar Loop, or the Loop area. So if you move a little bit further east of the Del Mar Loop area, along Del Mar, we find the Del Mar Divide. And so sort of on my far left is sort of east, and the eastern border is Taylor Avenue. At the top, sort of going west, is Kings Highway, and south is Lindo. So that's almost sort of the Central West End area, close to Barnes Jewish Hospital, close to the Chase Park Plaza, for those of you who sort of know these kinds of landmarks in St. Louis. So if you are south of Del Mar, home values are over $300,000. Income average is $47,000. 67% of people who live south of Del Mar have bachelor's degrees, and it's 70% white. If you're north of Del Mar, it's 99% African American. 5% of people who live in that area, in the red area, have bachelor's degrees. Average income is about $22,000, and average home value is about $78,000. And so every community has a Del Mar. So in many ways, this is not only sort of a physical marker, a physical way of sort of separating people and looking at differences, but it's also a metaphor for other communities to think about, well, where's the Del Mar in your community? Where's the Del Mar Divide in your city? So it's really important to think about where are those physical barriers and sort of what's the social realities by those physical barriers that we have. So again, this is sort of looking at the dissimilarity index for St. Louis. We can skip this one just for the sake of time. Okay, thank you.